Pericarditis by Jenny Ziegler for Anatomy and Physiology 2. What is pericarditis, you ask? Well, it's where the pericardium of our heart gets inflamed. The pericardium is a double thin layered fluid-filled sac that surrounds the heart. It also helps to protect and keep our heart in our chest cavity. The inflammation is usually caused by a virus, bacterial, or fungal infection. But usually pericarditis cause is unknown. However, it seems to occur often after a viral infection that causes a chest cold or pneumonia and is more likely to happen to men between the ages of 20 and 50. Other causes can be recent heart attack, autoimmune conditions, lupus or rheumatoid arthritis, kidney failure, hypothyroidism, cancer, and some medications. There are two types of pericarditis, acute and chronic. Acute happens usually suddenly, but is usually resolved in less than 3 weeks. Chronic can come on gradually, and it can continue after an acute pericarditis and usually last longer than 3 months. In severe cases, a person can end up with either constrictive or cardiac tamponade. In constrictive, the pericardium loses its elasticity and becomes tight around the heart, causing the heart to malfunction. This can lead to severe swelling of the legs and abdomen, and so as well as shortness of breath. Cardiac tamponade is a medical emergency in that the fluid buildup becomes too much, it limits the heart's movement, and restricts the chambers from filling with the appropriate amount of blood. This then leads the heart to be unable to pump blood. This can lead to heart failure and death. The signs and symptoms are similar in each type and can mimic a heart attack. The most common are chest pain in the center of our chest or to the left side, can feel like a sharp or stabbing pain, can feel it in the neck, back, shoulders, or abdomen, will not go away with rest, can last hours to days, worsens when you lay down, but when you get up and lean forward, it kind of goes away, is worse with swallowing, and can have a low-grade fever. How does pericarditis get diagnosed? The most physical diagnostic assessment is a friction rub. When using a stethoscope, you will hear crackling or a scraping sound, which is from the inflamed layers rubbing together. Otherwise, blood work to look for signs of infection or inflammation, an ECG, echocardiogram, a CT scan, MRI, a culture of the pericardial fluid, or tissue biopsy of the pericardium. Treatments included could be, if the pericardial infusion puts too much pressure on the heart, they can do a procedure to remove the fluid with a needle called pericardial synthesis. If constrictive pericarditis develops, surgery to move part of the pericardium can be done to relieve the tension on the heart. But usually pericarditis will usually clear up on its own with rest without treatment if it's mild. The more severe cases can be treated with NSAIDs, steroids, or colchicine to relieve pain and inflammation. Thank you.